Hello, everyone. It is my pleasure to welcome you to today's New Hampshire Healthy Climate webinar. And I am really excited to host Alex Gesse this evening for what I think will be a very inspiring talk on nature-based interventions. Just a couple of reminders to get us started this evening. So I wanted to just remind participants to keep yourself muted when you are not speaking. And there will be a recording, as you probably saw, of today's webinar that will be posted on our YouTube channel later to all registrants. The next thing I'd like to do is just read our land acknowledgement. So this webinar takes place on Ndakina, which translates to our homeland and is currently called New Hampshire and Vermont. Ndakina is the unceded traditional ancestral homelands and waterways of the Pennacook, Abenaki, and Wabanaki people, past and present. We acknowledge and honor with gratitude the land, water, air, flora, and fauna, and the beings who have stewarded Ndakina throughout the generations for over 12,000 years. Thank you. So with that, I would just like to briefly introduce Alex. And Alex is the executive director of the Forest Therapy Hub based in Barcelona, Spain, and Portugal. And he specializes in designing mindful, nature-connected activities under the theoretical principles of human-nature interaction, scientific evidence, and the planetary health framework. And it's really this evidence-based approach that is one of the things that I have really enjoyed personally about Alex's work and getting to know the Forest Therapy Hub team a little bit better. So I think you'll really enjoy the connection to research. So with that, I probably will just want to, without further ado, turn it over to Alex so he can share some really exciting information with us this evening. Alex, over to you.
Thank you, Sembra. Thank you for also for the invitation. Also, Emily, for hosting this and for the invitation, and also to all the participants that are here. No, because with the participants we don't have webinars, so it's fundamental that you are here. So thank you for that. I'm Alex, as Sembra mentioned it. I'm one of the trainers of the Forest Therapy Hub, and then I have the obligation of being the executive director, so doing the paperwork, but we like is to be training people and also to be a practitioner, not being in the forest. And this is the beginning of our story. So I will be doing a presentation that is linked with what we have been done the last 12, 13 years. So not just me, I'm representing a group of people that work and collaborate together. As Sembra mentioned it, I'm from Barcelona in Spain. But I moved to Lisbon, that is about 1 hour and a half from Barcelona with a flight 10 years ago. Basically, I'm not English native speaker. If I'm not clear with something, just let me know. This is about you, so no shame. Like, hey, Alex, please. Or I will be introducing the presentation, and then it will be a moment for questions. No, so here we go, and let's go with the presentation. So can you see it? Yeah. Okay, cool. Thank you. So basically, designing and validating nature-based intervention, our approach. So I was mentioning, just I would say couple of years ago, two years and a half, we realized that we changed it as an organization. No, we evolved it. So basically, we started, as I mentioned it, as a practitioners, designing interventions and working with people in the forest, in parks, in the beach, working with different kind of populations, mental health, elderly, kids, children, adolescents at risk of social exclusion. And at some moment, we noticed that we need to teach that, no? We need to also share what we are discovering while we are working, no? Like a shoemaker, no? But at the same time, also bring in science. And then the next step, it was, okay, we are applying science doing by others. Now we need to develop and to research by our own. And then we started to establish partnerships, no? And this is a bit of what I will be sharing, no, and how we have been designing and validating nature-based interventions, and not just validating by ourselves, no, and this is truly important at this moment of our kind of practices, no. So nature-based interventions, that for us is an umbrella term that can join plenty of different kind of practices and interventions. So again, sure that if you have been in nature, you feel something, no? I will be inviting you to share in the chat if you wish, and if you are a bit shy, you don't need to share. But it's beyond noticing, no? We notice that we feel relaxed, probably. We notice that we feel good, content, but we need to go beyond that, no? We need to research why this is happening, which are the best ways. We all know that being in nature is good for us. We all notice that. But what if we can introduce some techniques that improve how nature impacts in our health and well-being? If we can design techniques that can improve how nature makes me feel relaxed, no? And I'm seeing here relaxed, Daisy. Hello, Daisy, because I know Daisy from Korea. So this is what we do, no? We develop techniques, we develop a method that aims to improve the benefits that we get from nature, no? Aims to provide us or provide the practitioners with knowledge to expose in a better way their participants to nature, no? Being inspired, energized, healthier. Yes, it's all of that, no? But how we can improve that? So one thing that we have noticed, and also with the research projects, is that for us, as I mentioned, nature-based therapies, nature-based interventions, outdoor therapies is an umbrella term that mixes plenty of different approaches. There are about 50 different kinds of nature-based interventions that you can find described in papers, in books. But what happens? That most of them are not really well described in our papers. Even you can find that people has been in nature practicing or with nature-based therapy, and this is basically a therapy session with a psychologist in a forest, and in another paper we refer as nature-based therapy, and then the description means that someone has been walking for 3 hours through the forest. So in a way, we are mixing tomatoes and potatoes, so we cannot compare. That's a reason that from the beginning, our approach was to establish clear definition, no? And specifically, the kind of interventions that we design are related with nature connection, but mainly with forest bathing or forest therapy. Probably most of you know that forest bathing was created in Japan, or was coined, the term. So it means being immersed in the forest. It means also expose yourself to nature. But then, as the term or the original term, which is Shirin-yoku, moved to the Western world, we truly believe that now we are practicing something different, no? In Japan, Shirin-yoku is quite linked to their culture. It's quite linked to their way of doing, how they relate with nature. And then as we move to our areas, to Europe, to America, then it's something more social where we interact. But beyond that, what is the most important? That if we want to take advantage of our own relation with nature and how this improve our health and well-being, so to embed this into the healthcare systems, we need to speak the same language. So that's also the reason that from our point of view, or the approach that we have developed, but also the approach that now is being researched, for us, forest bathing is a well-being practice. It's health promotion, disease prevention, it's for general population. So like following a healthy diet, like going to the gym to keep you fit, to keep you healthy. And then forest therapy for us is disease prevention, rehabilitation and intervention, treatment. So working with specific populations, with specific needs, designing specific interventions, looking for certain health outcomes. So I will say that while forest bathing is about spending 3 hours in nature, or perhaps bringing healthy habits to my daily life, forest therapy is more about spending time every week with a specific design done by a healthcare professional or by a forest therapy practitioner in our case, in collaboration with healthcare professionals or in collaboration with social workers, in collaboration with activists, because this is this kind of holistic interventions. No? So what we have been doing is in the last 12, 13 years, is implementing this kind of interventions. Or we directly as Forest Therapy Hub and also our trainers, but also the people that we have been training all over the world. We will be talking later about this, but we have trained about people in about 80 different countries, so 80 different countries. And some of them has developed this kind of interventions based in our models. So from here, now we are evolving and we created a specific method that I'm happy to share that actually is the unique method for forest bathing and forest therapy that is being researched at large scale. In a European founded project by European Union and UK, financed by them, but that is being implemented not just in Europe, it's also implemented in America. No? So, and you will see that we have been learning through all these kind of interventions: mental health, loneliness in elder adults, bullying in schools, gender violence, so all types of intervention. And now is the moment to test them. No? And we'll be touching a little bit. So what we are doing, because if we talk about the descriptions to support us to embed these kind of practices as a complementary services to our health and well-being into the public health care or private health care, we need definitions, but we also need a standardization. Because our public health system or private health system, so our health systems in general, work with a standardization. You have this disease, you take this pill. You have this other disease, you take the other pill. And as an organization, we truly believe that with nature-based interventions, this is impossible. This is not possible because we are a complex ecosystem, humans, and the forest or nature in general is a complex ecosystem. When we mix both, it's really complex. So all the interventions that we design needs to be adaptable, so needs to be flexible to the specific context in which we are working. Cultural context and environmental context. So which was the solution that we found in all this process? So working with different components. So basically, the methodology that we have developed work with components. So what we are standardizing are components, not the interventions itself. So this allows to adapt these interventions to the specific location, a urban forest, a park, a garden, in the wild, the different characteristics of these environments. In different parts, we have different characteristics of the park, but also to the specific populations that we are working with. And this is really important because even when we talk about children, this group is completely different than the other group. Or mental health populations are really different one from another. Or people from even within the different states of the United States, you have probably, or you approach things differently. So our own specific context of humans, no, and how we perceive things. So basically, these components, we combine them to design the interventions. And these components are nature connection activities based in the model that we have developed that we'll just briefly touch on it in the next slide. But basically, designing nature connected activities based on science. So activities that should support us as a professionals to expose people to nature in order they can get in interaction with this space, just to expose them to a place that we know that is good for them, like near to trees because the monoterpenes, or near to water areas because of the negative ionization, or just offering them a mindful connection with this environment. No? It's not just about mindful connection. It's not just a chemical or physical connection. We need to operate at all levels. No? And then sequencing these activities. The way that we sequence the activities give us time. This is related with the dose of nature. So the amount of time that people will be expending in nature while they are attending the intervention. No? But at the same time, we have been analyzing that different activities organized in different ways also have different results. Also, nature, I'm going to keep nature-based activities for the end because it's my favorite one. So also expressive art in nature. So nature connection activities in which we use art to connect with nature, to express ourselves, natural elements. But this art is not about the goal. So that I need to build the most amazing thing in the world. It's about the process itself. No, it's about how I use nature to express myself, to connect with nature. No, and awareness, noticing. So how I am aware of the way this space is impacting in my health and well-being. Is impacting in my mood. How my relation with the other participants that are attending the same interventions, because these are also group activities, are impacting in myself. No, and for me, the most important one, nature-based activities. So nature connection activities that are designed for me to bring this kind of activities to my daily life, to bring nature to my daily life. Something as easy as noticing how some elements in nature are pleasant to me or are relaxing me, and then how I can look for these elements in my daily life. And it can be a plan. It can be when I'm getting tired, listening, recording with birds. It can be just from time to time stop and look at the window. Each one of us will need different inputs, no? So also for us is about this. So bringing this nature to our daily life. No? So and how we apply that, and this is really brief because this is really complex behind this model that we have developed, because one of the problems that when we started is there was not a model, there was not a conceptual framework, no, of our own relation. So, and this is inspired, no, we have not started from the scratch because for us it does not make sense. It has some of the bases are related with sociology, some of the bases are related with different psychological theories. It's also grounded in research related on how we interact with nature, but we ground it, no, not just theories, practice, experience. And basically we consider, and this comes from also the determinants of health, there are certain things that we cannot change, no? Our age, sex, our hereditary factors. And then there are aspects, states of our health, our psychological states, our social states, our spiritual states, our physical states that can be improved through our contact with nature, through our interaction with nature. In this area that we call liquid interactions with the environment, no? In which we expose ourselves, we expose participants to sensations, emotions, or even better, we expose them to chemicals. We experience them to physical aspects of nature. And then they get sensations through their senses, and these split emotions, these split thoughts. No? And so they interact with our social environment, but because we mentioned that this is a group activity, and also interact, or in our case, micro interactions with the environment. No, we expose them to microbiome in the floor. We expose them, as I mentioned, to monoterpenes, so these substances that the trees spread and boost our immune system, and several other aspects, no, of nature. And we truly believe that these four states, and just mentioning that for all spiritual states are not related with any kind of religions, for us, a spiritual state mean basically quality of life, no? If my life worth it, if I'm satisfied with my own life, no? And then this can be linked to all kinds of spirituality, but we cannot frame how people must live their spirituality, no? And then I think that the other ones are more easygoing, no? Psychological states, no? Mood, anxiety, social states, the quality of our interactions, the quality of our relations, and also body, no? And then there is one that is there on the left up side of that is planetary health, no? We truly believe that planetary health also it's part of our health. So if the planet is not healthy, we cannot be healthy. Even just consider if you have someone in your family that is not healthy, can you be healthy? Or are you going to be stressed because you have someone ill in the family? If you don't have a good relation with your coworker, even that you love her or him, or you hate her or him, you cannot be healthy. So it's about looking for this harmony among all the elements, no? Our social environment, our natural environment, and we as an individuals, no? And the interactions among these three aspects of, or really important aspects of our health and who we are, no? As individuals. So, but there is a risk. As I mentioned, when we started this research, and some of, as I mentioned, our team, 99% of us are practitioners, but in a way we fall into the research projects, no? But some of us has been researched, not specifically me, but some of my colleagues has been researched about terminology, frameworks, and different descriptions of all these kind of different practices. I mentioned there are not frameworks. In most of the papers, it's not clear what what the participants are doing in the forest. We kept with the health outcomes, but not with the descriptions of the spaces. So which characteristics should the spaces have? And we don't have information on specific activities, no? As I was mentioning, if it's psychotherapy in the forest, if we are walking 3 times, if we are doing meditation, no? So this brings also some risk because, as I mentioned it, now the trend is a bit, everything is science-based, no? And this is not true. The work backed by science is not true, because there are not methodologies, and specifically in forest bathing or forest therapy, that has been tested. When we say that forest bathing or forest therapy is science-based, that's true. When we refer to specific methods, specific methodologies, this is not. Because then we need to test the specific methodologies, and if one is better than another, and then evolve them, no? So we also raise the flag about treats to nature-based interventions and how medical fields and other kind of aspects related with our health and well-being can look at it, no? And not rising from minor evidence, saying that this is backed by science, not built just on ideas, but built in real science, not because someone that is a piece of science, no, but a PhD with a group of 20 people testing something. We are building science, but this is not guaranteed, no, of that this is backed by science, no. And we need to be really aware of this. And as I'm always mentioning, we cannot be in our own bubble, no, saying that, oh, this is backed by science. No, being in nature is backed by science, no. Let's try which techniques improve this, no. And this is in the way that we are now, no, in different projects that we have been founded. So again, not science washing, no. And I need to confess that we are using this term adapted from the page of the United Nations and some of the descriptions for greenwashing. No? So this is also the effect, no, that we are having in the nature-based practices. So how we try to expand these practices, how to try that governments and health services embed this, no, about research, knowledge, exchange. So creating new evidence, sharing it, being open, creating networks, and training people in a professional way, no? So our aim is not to train people. Our aim is to train people in a professional way. If people just want to be trained, don't come to our house, because it's not our interest, no? So we want to provide knowledge. We want to start to develop even more and more, no? Or even sometimes it can be, or it can sound in certain rooms weird, but we need to create a field. We need to create an industry, because if not, people are not being able to enjoy. If not, practitioners cannot pay their bills and cannot support other people, no? As in any other field, no? So, and it depends of the country, will be supported by public health institutions. In other countries or in other spaces, people will be paying for it. We need to look the model that adjusts to every context, no? And every political situation. So I'm going to touch in some of them just briefly, but for example, research and knowledge, FT Hub now, we are involved in about 7 or 8 different research projects and capacity building projects uh, with about 20 US, no, 20 million US dollars. So I will say that actually we are the organization with largest funding to research on forest bathing and forest therapy beyond specific governments. No, I know that now we are collaborating with different institutions in China. China is investing a lot in forest bathing. In Korea, they had. Now it's more stopped. Some of them, no, just to mention, for example, Naturalab is a research project funded by the European Union, is being implemented in Europe and in America. They invested 6 million euros. We are a consortium of 14 different entities, universities, research centers, hospitals, NGOs, and our role is to design the nature-based interventions, no? To design the interventions. Now we we are going to train 600 people. We started with the first 100 just 1 month ago, and the interventions are going to be implemented starting in April, no? So we'll have the results of this research and how different interventions that we are designing using the components, combining them differently, which are working better than others. So we know that we don't have the final intervention, but we need to keep researching to be near to the final, but it won't be one. Probably won't be different compositions for different kind of people from different environments. No? Another project is, for example, Forest All also is financed by the European Union, but in this case, implemented in Europe and implemented in Asia. No? And in this case, we're analyzing the characteristics that a forest should have to be therapeutic, and specifically focusing into specific characteristics. And then in 5 different possible therapeutic forests will be implemented for intervention in each one. And in this case, our intervention it needs to be the same everywhere. So we keep like ceteribus paribus, no, in terms of people, and so that every keeps exactly the same in all the forests. So we can analyze the different characteristics of the spaces, no, and how they implement. But for example, just a couple of months ago, we have been awarded also for the European Union to develop a training for nature prescription for nurses. So providing tools to nurses to prescribe nature, because we are all talking about prescribing nature, but in most of the cases, it's just prescribing nature. We need to develop protocols. We need to develop specific activities, no? And this is what we are doing in this project, that it will be implemented in collaboration with the university, no? And the trainings starting, or the pilots to test the training that we are developing will be starting in June, no? Another project, this one that you can see here, Green Touch, is about providing students and university professors with nature-based tools to support their health and well-being. No? So there are several of them, and I was just mentioning with FENRA, just in the last 2 days, we have submitted about 12 different proposals for new projects, no? Of research, of implementation, and in the next 2-3 months, we'll be submitting 15 or 16 different proposals. And by we, I mean the next slide is not just FTH. Anyone can do this alone. We need to collaborate. So we have collaborations with universities in the States, universities in Canada, universities in Mexico, universities in Chile, of course, universities in Europe, but also universities in Korea or public institutions in Korea and also in China. No? So one of the advantages of the FT Hub is that we consider that we don't have a flag. We are a group of people that collaborate together, and in our board team, there are people from the States, people from Spain, people from Italy, people from Greece, people from Poland, and from different countries, no? And we love to think that we are dots of connection. No, for example, our seedlings director, that is one of the topics that I'm moving now soon. She's from New York, so Erika. That, by the way, she's traveling now because we have the directors and managers meeting in Italy this weekend. So she now is moving to Europe. So some of these partners are, for example, the Korean Forest Welfare Institute is the public institution which is under the umbrella of the Ministry of Forestry in Korea that has established about 20 different forest therapy stations. We have a collaboration with them, but we also train people for them. No, Planetary Health, we are members. I guess that you all know. These are two of the main universities in China that offer forest therapy, and some of their professors are professors also in forest therapy in our training. No, or MON is the Nature Therapies Institute of the University of British Columbia. No? So about collaborating. So whatever you are involved with, our door is open, no? To send an email, to look for possible collaborations, how we can share knowledge, because again, this cannot be done in one day, and this cannot be done by a single man or a single woman, no? Or at least is what we truly believe in and the way that we operate, no? Also, dissemination. I really, if I will say that the golden, I don't know how is this term in English, no, but the key element of the presentation is every year we offer a global summit. This year is the fourth one. This is offered in English and in Spanish, and also with translation. No, there are people offering translation, and we have the channel. And this year we'll have subtitles for several languages. To this summit, 90% of the people are researchers or practitioners that collaborate with FTHub. You will see amazing things. People implementing projects. Some of the top researchers, for example, this year we have added some new things that is talks between experts and are 20 minutes talks between experts. This year you have a talk between Melissa Lem from Canada, that probably you all have heard about her, and with Jill Litt from Colorado, and is one of the United States researchers that has been working in Europe, and she led one of the largest research projects in nature-based prescribing. Nature-based social prescribing, sorry. So that's just amazing. But it's also amazing that the last table or the last conversation is two young researchers with 20-something that they are doing amazing things. So the future, no, of this practice, when probably we got retired in perhaps in some years, they take our role, no, and this is important, no, to provide a stage for them, no, and then, but there are people from Korea, people from China, people from Taiwan, people from different countries of Europe, South America. So the real practice, no? So yeah. And then the network, no? Another piece that how we use, no, and how we expand this knowledge is that we have created the Hub Seedlings, which is an independent organization of the Hub that is led by 20, 30 different volunteers. And they provide support to practitioners that work with nature. So they offer calls in English, Spanish, Italian, and Polish. I think it's every month and a half, and they try to start collaborations and different things. No, this is led by Erika, no, who is our director based in New York, as I mentioned. But in this case, this is focused on the professionals. So FT Hub is supporting it. We have a director that dynamizes it. But the last decision is the practitioners, is the space. We don't interfere. We just finance it with resources for whatever. Here you have also their blog where they are constantly posting different things, and they invite people also trained by other organizations, people that are not even related with forest bathing or forest therapy, and practice also other kinds of nature-based interventions. So for us, it's about building what in my land, in my hub line, we say to build a school. And to build a school is not to build a school like the building. It means to create network, no? It means to create roots, no? But also the building, no, just in case it's raining, no. So, but the network, no? And then, of course, training. We have different kind of trainings, but in this case, I'm not going to go deep on that because it will be. But also, is a way, no, as I was saying, no, to expand, to pass all this knowledge that we are creating through science, but also at practitioner level, no, working directly with people, no, if it's better this trail or this other, and how base it also in what we feel as a professional, no, how we read our participant. But I would like to touch just in one of them that, as we mentioned it, next September, we are offering one training here in Hampshire in collaboration with the University of Plymouth. Semra will be also there as a professor, and some of the members of your organization will have some advantage. No, for that you need to get in contact with Emily and Semra. Okay, but what is important, no, for me, the summer schools are a day immersions that is not just with our practitioners. Again, about creating network. They are attended by several experts from all over the world. It depends of the summer school are one expert or another. People like Dr. Won Sop-shin, who is the former Minister of Forestry of Korea, is one of our professors. He will be in New Hampshire. He also attend the summer school in Barcelona. Dr. Wang Yu is the Vice Dean of Forestry of the University of British Columbia, but also has been in really leadership positions in China. He is hosting, because the summer schools are always in collaboration with a public institution, University of Public Body. Uh, so in this case, is the University of British Columbia. No, Melissa Lem also is one of our professors at the University of British Columbia or Vancouver Summer School. No, probably you know Kaylin Wolf. No, this year at the end she dropped off because she had a last minute thing, but it was supposed for her to be present also in New Hampshire. No, Kristen McEwan from United Kingdom and the unit of University of Derby. You know, Nature Connection. They are at the lead. She will be in Barcelona. In Barcelona, the summer school is in collaboration with the Barcelona City Council, no? And Neville Harper, one of the most well-known experts, also a university professor, but also a practitioner in nature-based therapies, no, or outdoor therapies. That is the term that he prefers to use, no. Again, Jill Lead from Colorado. Now he's living between Colorado and Barcelona. She lead a huge research on natural prescription, no? Or my colleague Carlos. Carlos is one of the co-founders of the Planetary Health Alliance. And this is not about training. Again, this is about collaboration. This is about spending this knowledge. This is about that when we mix in a summer school, we are not just training people, we are creating in bonds. No? I remember that most of the students of the summer schools are university professors, and then they start to set up different projects, different ideas, different collaborations. No, so it's in a space, no, also for collaboration. So again, who is FT Hub for? We are for professionals, professionals that want to implement, professionals that want to lead, professionals that want to create network, professionals that want to create knowledge. No, as I mentioned, no, now we are over 80 different countries. I'm seeing that I have not updated my presentation. I have been lazy on that. Sorry, but we have trained people from plenty, several spaces, places, locations, different environments, no? And also we have a group of a LinkedIn group with all of them are together, no? Now this LinkedIn group, we have created it in the last year, and there are about 800 people there, no? So if you have something new to share, something new to ask, is the place, no? So that's all. Thank you for your time. If Semra and Emily allows, we have time for questions, and I hope that I have not been quite boring with my presentation, but it's a lot to cover, no? And probably, if you notice, is our passion, no, from our team, and we are about the main staff is about 10, 12 people, and then with professors and trainers, we're about 30 or 40 people, no? In our therapy hub. So thank you.
Well, Alex, thank you so much. Your enthusiasm is contagious. So thank you so much. I'm sure everybody really enjoyed this, and we do have a good 20 minutes for questions. So I'd like to ask Emily to help to identify questions and read them. People can put questions in the chat, and Emily will help to facilitate the next part of our program. So Emily, go ahead and let's get the Q&A started.
Thanks, Simra. I know Alex really was hoping to reserve this time for a more interactive discussion. So feel free to hop off mute if you're comfortable and ask your questions, or if you are feeling shy and want to put them in the chat, I'll be here to read them off and make sure we get them answered.
I'm happy to come in. Hi, Alex. Thank you so much for this presentation. I'm a trainer of mindfulness-based stress reduction teachers, and often run into teachers who have done forest therapy training and incorporate that in their teaching, which is wonderful. And I love the evidence basis, and particularly appreciated that slide that you put up with risks. So my work is inviting mindfulness-based stress reduction teachers to recognize that we're in an inter-embedded and interconnected living environment. And one thing that I caution people about, and that's really all my work right now, is bringing MBSR teachers and MBCT teachers together to train them on something they never got invited into, which is to recognize that the living world is part of us, and we're part of it, and it needs to be part of what they offer to students. Okay. And that, there's beauty and strength and awe and delight that is evoked when we can be in nature. But also there's the other side of the coin. And many people have climate anxiety and concern and want to do something. Our students come to us, and so MBSR teachers need to be ready to hold space and invite that kind of awareness in as well. So one of my cautions to them is not to over romanticize nature, and to recognize that we have, as much as we can benefit and draw from nature, it's like the giving back part, the reciprocity is equally important. And I wonder how you handle that. I know this is primarily a health intervention, and I think that's wonderful. And I would never stop anybody from inviting folks out to feel that connection. But I just, the reciprocity part is really important in my ethos, and I'm trying to invite MBSR teachers to recognize we can't just kind of think of nature as let's go out there and get something that will give us better, feelings of wellness and so forth. It's got to be reciprocal.
Thank you for this question, because this is really important, no? And something that we teach to our students is that nature is not for everyone first. You were talking about eco-anxiety, no? But it's something as easy as perhaps I have some kind of allergy, I cannot go to the forest. Perhaps I had a stressful situation in a natural environment and I have suffered trauma and I cannot be in a garden or in a forest. So this is why, and we have been bringing this from one of our trainers and experts, is about our own eco-identity, no? Which is our relation with nature, basically, no? So I'm feeling good in nature, I'm feeling good in a park, I'm feeling good in the forest. So, because in most of the cases, no one analyzes that. Even in the most serious interventions, no one understands how we relate with nature. So this is the first point, no? And I'm quite linked with that because I almost passed away 4 years ago because I was bitten by the tick, and it was not even, I lose my vision, I lose plenty of things. So we are quite aware of this point, no? And then reciprocity for us it's part of it. we cannot even consider if we consider it or not. So, and this is what we were talking about planetary health, no? Is this reciprocity? With this, does not make sense, no? Because my question is where we end and when nature starts, there is no end of start. We have plenty of different microbacteria in our body that with them we cannot survive. So where this ends, no, where this starts. So for us, it's fundamental. It's just not even about something that I can do in terms of reciprocity because I'm feeling grateful, and or at least this will be my main understanding, no. But and one of the theoretical bases of the model includes reciprocity, no. But sometimes, even when we place and we teach about reciprocity, it looks that we should give because we are in the power of giving, no? Or we are no. We need to be in harmony because if not, we don't survive. So when people, the other day, we were also in a conversation, I was in a training that we offered in the Vatican for high top decisors of large corporations. And someone raised the point, no, of, yeah, because we can destroy everything. No? And I said, are you sure? Because this is the problem, that we think that we are taking care of nature. No, we are taking care of ourselves. Because probably, of course, that in the way we will be destroying plenty of different species. But the planet is going to survive after all of that. So the unique ones that will be disappearing is us. So at the end, and I'm linking this also with the reciprocity, no? It's fundamental, but it's not fundamental in the term that we are in the position of giving, or that we need or that we have it's mandatory for us to give. That is basic and functional. We need to be in relation. If not, we don't survive. No, if you are not connected with these spaces. No, so of course, yes, Margaret is really important and it's part of it. No, but then again, when we talk with public health systems or with private health systems, we need to speak this language. No, the language of the intervention, the language of the internalization, because our final aim is not to sell anything in terms of selling our ideas. No, it's to create something that can be used by the maximum number of people, no? Because spending time in natural areas, it's free. But also this brings another aspect. One thing is to go with 10 people to the same forest for them to experience nature and to improve their health. And the other thing is to go to the same place with 40,000. No? This is also something that we need to take into consideration, no? When we are also choosing spaces, choosing areas. No? Yes, I have answered your question. Bye-bye.
There was a lot in there, and you spoke fairly quickly. I was having a little bit of trouble following. I wondered about that model and where reciprocity fit in there, and I don't see that word. I understand you're talking to big institutions who are primarily, taking care of people and their lives. And I also want to challenge you to, like speak truth to those kinds of institutions that, well, it is true, the planet itself will be fine. But our human impact is impacting on species loss. And the more we keep kind of ignoring that or brushing, kind of jumping over it, the bigger the trouble we get into as time goes on. So I want to challenge you to be a little more truthful with these power, like power situations at the top when you're talking to them. Thanks for
We are, we
dialogue.
are, we are doing that, but not our truth. So basically, to exposing the situation as we see, no, which is at the end is how we interact with all of that. No, of course. Yes.
Yeah,
Thank you,
being
Margaret.
in really good relationship with land and water and creatures. Yeah. Thank you.
Thank you. Tamra, you have the hand.
Yeah, I thank you. I just wanted to really thank Margaret for that question. And one of the things I'm personally hoping will come out of this collaboration with Forest Therapy Hub, and especially the visit to New Hampshire, is exactly, Margaret, what you're talking about. What attracted me to this was the link to the Planetary Health Alliance model, very connected as a public health professional and a teacher of environmental health. to the reciprocity that you spoke about and to make it more concrete. So I want to rise to your challenge, and I want to engage in conversation, hopefully with everybody here, in terms of if we get a bit of a movement, because part of the thinking about planetary health is as a movement, a social and ecological movement, then how do we think about people who are spending time in nature, but how might they then give back through other avenues of activism, of stewardship, of not sure exactly what the right group of words is, but to actually embody the kind of reciprocity that Margaret was speaking of. And I know here we're trying to do that in part through New Hampshire Healthy Climate, which is why I thought this would be a great host for the webinar. There are also other organizations and nascent social ecological movements in our state and across our region, some connected to land trusts, some connected to indigenous groups. And I think it's enabling through this, whatever we're building, to help people understand how they can tap in and engage in collective efficacy. So that's my pitch. And maybe a question is inviting us all to think about that and how we can use the forum and the collaboration to incentivize that a little bit.
But it's going to the basic of the models about what I was sharing of, and completely agree, Sembra, with your thoughts and these strengths of collaborations. But is this harmony, no? Is the basic principle of biology, homeostasis. Mm-hmm. You spend energy, you eat, and you recover energy. No? And then, sorry for the expression, and then you poo and you get back this. So, and it's a cycle. So it's about being aware of this harmony and that this is fundamental. And harmony implies reciprocity because it's an exchange. No, it's an exchange of whatever. No, or when you were talking about awe, no, Margaret, this is an act of reciprocity. When I have an experience of awe and I'm getting just my expression, we don't know how the space in which we are is receiving, no, my awe. So again, no, is it this thing of harmony implies this kind of interaction. So thank you. I'm seeing Alex also with the hand raised.
Yeah. Hi, Alex. I thought it is not possible to fall deeply in love with your ideas, but every time I'm more deeply and deeply in love with what you are speaking about, especially about the science. So you have the global view. So I would like to ask you, have anybody till now made some kind of meta-analysis of what has been published about forest therapy and forest bathing in indexed journals like Scopus and WOS? And have they been evaluating according to some criteria that you have mentioned, that there should be randomized control trials, there should be large samples, there should be the most important standardized protocols? Or if not, are we brave enough to organize a group of scientists to do this, first to establish the criteria and then to pass all this and to see what we left? I'm afraid that just a very small fraction we left after we see what has been published. Even I think it's about 500 papers, not more, if we go through the key words, forest therapy and forest baths. But I think it is very important. So we have to distinguish those papers that have been published, but they are not following the minimum criteria of showing that there are some results. So I think this should be the basic start for what you are doing when you are saying that we have focus on evidence-based medicine protocols at the same time when we are speaking about the results of forest therapy. I know people will hate us. We will lose many friends, but I think somebody has to, do this. Because
Yes,
every year
some
there are
people
more and
are.
more papers. Last year it has been more than 400 papers published with forest therapy keyword. Just in 1 year, up to then it was about 400, 500 in last 15 years. So it's a progression of papers, but very pure quality, according to the protocol and samples. And
I would
they cannot
say.
be replicated. They cannot be replicated because they are not even described what they are doing. We don't know what they are doing. We just see the
And this
result.
is a problem with plenty of science, no? So basically, and in line with what you are saying, the main problem is that, or the main aspect or situation that we have is that we are humans. So then, just 6 hours ago, I was in the planning of a project which is looking for a grant of 8 million, so about 10 million US dollars. And the topic was, do we have control groups or not? And this is the same discussion in all the projects. And then which analysis are we going to use? And then if we use others that are related to other projects, or we have this inspiration as humans that we want to create something new. So we are not going to use what has been done, no? And this is constantly, no, the discussion. I will say that there are plenty of poor quality papers, not just in forest bathing or forest therapy. It has been increasing in all practices because there are plenty of now places where you can publish, and there is a lack of publishing material.
Especially if you pay for.
Yeah, exactly. And this is the main problem, no? But this is a much more larger project that we are facing. So again, I think that all fields need to go outside of the bubble and move toward that. No?
It was just the opening of the question that is always on the table.
Yeah, and just answering also Margaret. So measuring pro-social and pro-environmental attitudes, I know that in one of the projects that we are involved, because, or just to be clear, another thing, and related with what Alex is saying and what you are asking, is that there is plenty of science that say, oh, this went really well. And if you take a look, the people that guide it is the same that designed it, is the same that researched it, and the same that paid. In our case, we never get involved in the research part. So they say, we want to research that and we are looking for these outcomes, and then we design the interventions. So to be honest, I'm not sure, but I will say yes, that some of the aspects that you are mentioning, for example, in one of these large projects is involved. But we try to be as less involved as possible in the research part, because if the other day I was talking with someone at the university, and they have a PhD. This PhD is from a large organization, financed by a large organization. So this in Europe probably will be put it down, in terms of which is the validity of the results, So yes, and we are really. If the question, I switch a bit your question, Alex. Are you interested into research that? This is fundamental.
Really appreciate your spending time.
Thank you so much, and also to the people that I've met today, like Margaret, and for the ones that I know from as Alex Ardesi, I'm seeing you there now. So see you there in the forest.